Hi, I'm Dr. Andrew Shuman, and thank you for joining my tech talk. I appreciate everyone coming today. I'm contributing editor for Contemporary Pediatrics. I'm an adjunct assistant professor of pediatrics at Dartmouth Medical School, and I'm a member of the executive committee of the provisional section on advances in therapeutics and technology. For approximately 23 years, I've been writing about technology in the office and setting that has been presented in the pages of Contemporary Pediatrics. I just want to make it clear that I'm very opinionated about technology and how it can be used, how it should be used. And those opinions that I'm expressing today are my own and don't represent those of Contemporary Pediatrics, Dartmouth Medical School, the AAP, or the provisional section on advances in therapeutics and technology. So today I want to go over a few of what I consider some of the newest and best devices for pediatric practice. Every year in December I have an article that is published usually in the December issue of Contemporary Pediatrics that highlights these innovations. And I'm very much encouraged by how pediatricians have, over time, adopted new and exciting technologies, put them into practice, and clearly made a difference in the healthcare of children and infants. So this month, I have an article on the nuances of electronic health records for pediatric practice. EMRs and EHRs are themselves new technology, but perhaps we'll talk about those in a future Tech Talk lecture. In the past, I've talked about a variety of products over the 23 years I've been writing my tech articles. Some of them have been subtle, some of them have been very sophisticated and really have advanced pediatric practice significantly. I'm on a slide that says past new products. Displayed here is a device that obviates the need for using typical an office disposal system. You actually put all your disposable waste in a canister along with some plastic pucks. It heats this to over 500 degrees and you end up with a plastic puck that you can dispose of in a trash canister. So it actually saves a significant amount of money. Displayed here also temporal artery thermometers, an ear popper, which you can use for eradicating serous otitis media, an easy I/O for facilitating I/O access, video otoscopes, new technology for doing hemoglobins, and an AccuVein. So this year, there seems to be a lot of new products out for wart therapy, and displayed here is the Cryo, which is a disposable device that costs approximately $350. It uses nitrous oxide to provide a freezing spray that is good for treating approximately 20 warts. Pediatricians are probably aware that reimbursements for warts are very good. Wart treatments are quite good, averaging about $100 per session of wart treatment for up to 14 warts. So this device pays for itself multifold. A device that I've used in my office for a number of months is the Cryo Probe. It actually uses disposable and replenishable canisters of nitrous oxide. What I like about this device is that it uses replaceable tips, so you can gear the tip to the size of the lesion, size of the wart you're treating. A more sophisticated device involving significant amount of maintenance is the Cryo Pen, displayed on the right side of the screen. You would have to treat a lot of warts during your day because it requires daily maintenance, placement of metallic probes in a freezing bath. So you really have to have a high volume wart practice to justify the purchase of this device. As pediatricians, we're sensitive to the needs of our patients regarding reducing pain. making the experience a good one for our patients. So I was very pleased to learn that a pediatrician did some research on and developed a device called the Buzzy. The Buzzy is a little battery-powered vibrator that uses the gate theory of inhibition of ascending pain sensation. It combines this vibrator with a cool pack, and when you place it over the arm of a child, it really reduces the amount of the pain associated with needle sticks, procedures, suturing, etc. I've used this for several months as well, and I have found that it really reduces the amount of pain that kids complain of. It distracts them, and it's particularly more effective on kids 5 and above compared to kids who are 4 or younger, for reasons that I don't know, nor does the inventor know. But it's well worth your investment. It's only $35. So pediatricians would be well advised to consider adding this to their practice repertoire. Now, I happen to have practiced pediatrics back in the day before CLIA 88 and OSHA, and it was a kinder, gentler time for pediatric practice. We did strep tests in the office. We read our own Uricults. And because of CLIA 8 regulations, pediatricians started to abandon a lot of these more sophisticated tests. CLIA wave tests have returned recently, particularly with a device called the iStat, which I wrote about in the past, very useful in the hospital environment. The Piccolo xpress chemistry analyzer can be leased for as little as $300 per month, and it uses panels of discs that can do panels of assays. Results are available in 10 to 13 minutes. It does tests that pediatricians most often would request, basic metabolic panels, comprehensive metabolic panels, total serum bilirubins. So this is well worth considering for pediatric practice. There's a lot of entrepreneurs in pediatric practice, so the next few slides will show some products that people have contacted me about. Some of them are being displayed on the exhibit hall today. So this is Exam Buddies, and the idea is to create a more friendly environment for our patients. So these are plastic little devices that fit on top of your typical otoscope, your ophthalmoscope, on your stethoscope to make the experience a more pleasant one for children. There is an emergency room doctor, Joseph Schultz. He's actually a pediatric emergency room physician who has come up with a wide variety of new devices to improve the ability of physicians to treat a variety of conditions in the emergency room setting. So he's come up with the splash cap, which protects the examiner from being splashed with secretions during a examination of the throat. He created what he calls the Easy Ear, which is a flexible ear curette, which is smooth and doesn't harm or scratch the ear canal when one does a ear exam. And for emergency room use, he's come up with a splash cap for wound irrigation and the eye cap, which seems to improve upon existing technologies for performing eye irrigation and wound irrigation in an emergency setting. And lastly, a lot of parents are motivated to produce new products themselves based on their own experiences. Michelle Stalley is a mother of a premature infant who is oxygen dependent, and she needed to be able to bring her baby with her oxygen vials and tubes and so forth. So she invented what she's calling the Busy Breathers backpack, which has sections for tubing, for canisters of oxygen. So I applaud her efforts for making this available to mothers. Some of the new products have been evolving over the past few years. I've been most impressed with the 3M Littman Model 300 stethoscope. This product will blow pediatricians away if they haven't used one. It's a digital stethoscope. So not only improving on the sound that you hear, but it changes the analog sounds that you hear, both from the lungs, the heart sounds, into digital signals, and then recreates these at the earpiece. It lets you know what the pulse is. You can adjust the settings so you have the equivalent of a diaphragm or a bell. What is most spectacular about this device, it enables you to record up to 12 30-second tracks. This is particularly useful for demonstrating to a mother what the heart sounds like, what a murmur sounds like. It really makes patient education something different than what it has been in the past. In addition, it connects to software that has been rebranded by 3M Company to analyze heart murmurs. So this is something that has been in the works for years and years, but it's a computer-assisted device that helps you make therapeutic decisions. So when you connect the stethoscope to the software by way of a Bluetooth dongle, there's a very pleasant voice that works you through a 2-minute exam of the patient, and then by pressing a button, it tells you whether an echo is indicated or not. So clinical data provided by the company is most impressive. I have yet to see clinical trials, so I tend to be somewhat apprehensive. So I await clinical data showing the validity of this technology, but it's something that's been in the works for 10 or 20 years. So it's very, very exciting technology. The PediaVision Spot is actually on exhibit here in the Office of the Future exhibit. It's a very intriguing photo screener device that's been through several incarnations. When I had it demonstrated in my office, I was very impressed because it facilitates the quick photo screen examination of a child. Without their cooperation, it can be accomplished in as little as 30 to 40 seconds. And will let you know if the patient refers, has any possibility of a visual acuity issue, amblyopia, astigmatism that needs follow-up with an eye professional. There is some controversy surrounding this device. It's not yet been approved by the AAP or by the section on ophthalmology for a variety of reasons. Unlike ear screening, it has yet to be demonstrated by identifying a child with a vision problem early in their lives will make a clear difference in terms of their educational potential and ultimate IQ, etc. But I'm very excited about the potential for the PediaVision Spot. I understand that data is forthcoming, and if you see a demonstration of this device, it's truly very impressive. There's been a lot of improvement of devices we've used in the hospital setting and perhaps in the office. A lot of pediatricians are familiar with transcutaneous bilirubinometry. The BiliCheck has been redesigned to make it easier to use, faster. It can communicate electronically with EMR programs. In your office, it produces results that are very similar to total serum bilirubins, and in addition, it can be used in association with something called the Bili treatment phototherapy blanket, which uses LED lights for accomplishing phototherapy. So it's a new type of phototherapy that we haven't put in place yet. And I'm going to move quickly through Dragon Naturally Speaking, which a lot of pediatricians use in EMRs, to what I call a couple game-changing technologies. Pharmajet has produced an effective needle-free injection system which obviates the need for needles to provide vaccines to our patients. And as a pediatrician in general practice, I'm very sensitive to how fearful kids are of injections, of painful procedures. This is a device that uses a spring mechanism to deliver subcutaneous as well as intramuscular injections. It's been approved recently for intradermal injections as well. It's cost effective because it obviates the worry about needle sticks, and you don't have to worry about sharps disposal. You have a reset station pictured at the lower left, and adapters for filling multi-dose vials into the syringe. And the company tells me it is less painful than a typical syringe with a needle. And the last device I'll talk about today is produced by Masimo, one of the leaders in pulse oximetry technology. They produce a very sensitive pulse oximeter that one could use in very uncooperative patients, because if they move around and wiggle, it doesn't seem to upset the device at all. It uses special signal extraction technology. And they've devised a mechanism with their upcoming Pronto 7 device that gives you a non-invasive hemoglobin measurement. So this is the first of many devices yet to come that will facilitate diagnosis without needle sticks, without invasive blood draws. And as with other devices I mentioned today, we're waiting clinical data to support their use in the clinical setting. So I thank you for listening to my talk, and I'll see you a little bit later when I will talk about mobile applications. Thank you.